News. It's Friday, January 16th, 2026. I'm Dr. Ji Singh, and these are today's top medical headlines. Story 1. The Autism Diet Connection. First up, a breakthrough study in Frontiers in Nutrition provides genetic proof that diet directly influences autism spectrum disorder risk. Researchers identified specific immune pathways linked to dairy and gluten that may trigger symptoms, while certain fruits, like bananas, showed a potential protective effect. Story 2. Microhabits for Longevity. New data from The Lancet reveals you don't need the gym for longevity. A massive study of nearly 200,000 adults found that adding just 5 extra minutes of walking or even 5 minutes of additional sleep daily significantly cuts death risk for sedentary adults. Story 3. AI and Predictive Health. In technology news, AI is moving from reactive to predictive. Philips has launched a new rate algorithm, tested first with global sports teams, that uses wearable data to predict respiratory infections and physical overload before symptoms even appear. Look for this in consumer smartwatches later this year. 3D spine surgery breakthrough. First up, a milestone in orthopedic care. The FDA has officially granted clearance for the Picasso feature on the Paradigm AI platform. This technology allows surgeons to perform 3D intraoperative measurements during spine procedures, providing real-time alignment data that far exceeds traditional 2D scans. Robotic-assisted surgery milestone. In Canada, the Royal Victoria Regional Health Centre just launched its first robotic-assisted orthopedic program. Using the ROSA and Mako systems, surgeons are now performing personalized knee and hip replacements designed for faster recovery and extreme precision. Digital consultation tools. In plastic surgery news, Johnson & Johnson has launched the Arbria Breast Simulator app. This mobile tool replaces old-school physical sizers, letting patients visualize 3D surgical outcomes in seconds during their consultation. New coding and regulation changes. Major administrative shifts are also live. CPT 2026 has introduced massive updates for general surgery, specifically for diaphragmatic hernia repairs and liver tumor ablations. Meanwhile, the FDA has begun exempting more AI-powered wearable features from strict oversight to speed up innovation. Global warning: medical tourism. And a critical warning from today's journals: experts are seeing a surge in complications from outward medical tourism. Patients returning from surgeries overseas are placing a heavy burden on the NHS, sparking calls for stricter travel surgery guidelines. Maternal influenza and tetanus diphtheria acellular pertussis, TAP, vaccination during pregnancy was associated with substantial reductions in influenza and pertussis-related hospitalizations and emergency department (ED) visits in infants younger than 6 months. Medscape. Sudden cardiac arrest in athletes. The incidence of sudden cardiac arrest in athletes varies according to age, race and ethnic group, sex, sport, and social determinants of health. The common causes of sudden cardiac arrest include cardiomyopathies, electrical disorders, coronary artery anomalies, and other cardiac structural abnormalities. There has not been an increase in the incidence of sudden cardiac arrest in athletes during the time frame of the coronavirus disease 2019 COVID-19 pandemic. Primary prevention is based on cardiovascular screening before participation and secondary prevention on implementation of emergency action plans. NEJM. Anti-cancer effects of aspirin. The study by Yang et al. Reinforces the hypothesis that platelet activation is key to understanding the anti-cancer effects of aspirin. The anti-cancer effects of aspirin are seen with low dose, 75 to 100 milligrams. Once daily administration, and the pharmacologic target, the permanent inactivation of COX-1 in platelets, is well established. Platelets have no nucleus and therefore cannot resynthesize COX enzymes, so the suppressive effect of aspirin on the synthesis of TXA2 lasts for approximately 10 days, the lifespan of the platelet. The analgesic and anti-inflammatory effects of aspirin are mediated through inhibition of COX-2 in systemic tissues, which necessitates the use of higher doses, 300 to 600 milligrams administered up to 4 times per day. NEJM. That's your medical news update for today. Remember to consult a healthcare professional for any medical concerns. Stay informed and stay healthy. Don't forget to like and subscribe for more daily health insights. Disclaimer: use the content after verification.